Hi, I'm Jennifer Brush. Welcome to today's program. I'm a researcher, clinician, and author in the area of dementia care, and I work with healthcare organizations all around the world. Today, I'm going to answer the top 10 questions that I'm asked about dementia. I thought it made sense to begin this program by talking about these common questions and answers that family members and staff members have about dementia. And why do speech language pathologists need to know this information? Well, think about it. Have family members ever asked you or told you that they have trouble communicating with their parents? Have staff members gotten frustrated when a person asks them the same question over and over again? I'm sure that they ask you for help when a person with dementia is refusing care. Dietitians come to you if someone with dementia is losing weight. Sometimes we'll get referrals if a recreational therapist can't get a person to participate in activities anymore. We really work with a wide variety of professionals in our field, and we work with people who have a variety of communication deficits because of dementia. And it's important for us to know this information, not only so we can provide clinical services to people living with dementia, but that so we can serve as a mentor to other staff members, to colleagues, and for family members as well. So often, the approach to dementia is a focus on deficits. We point out all of the things that people can't do that we need to do for them. But there's a lot of things that people with dementia can do. And when we focus on that and we create an environment that's supportive, it's amazing to see their increased level of independence. You may not realize this, but there are different types of memory systems, and not all memories are equally impaired. For example, people living with dementia have a preserved ability of reading, and we use this preserved skill to help them compensate for their deficits. One way of creating a dementia-friendly environment is to use visual aids that include written information as memory supports. So what if you're trying all of these great communication techniques and the person's experiencing word finding difficulties? Okay? When someone's semantic memory is impaired, they're going to have trouble thinking of the names of things. So what can we do? Well, listen, pause, okay? Use that 20-second rule. Count to 20. Let the person try to formulate a response. Don't jump in with talking. Let them focus. If they can't find the words, you can try repeating back to them what they've said and give them a chance to fill in the words. Sometimes I'll provide two choices of the word that's missing if I think that I know what the person's trying to say. Sometimes I'll ask them to describe it to me or tell me about it. Okay? Sometimes having an item in front of me that I can point to or hold or give them to hold that has to do with what they're talking about will help to trigger the proper word. So I've given you a few ideas about meal planning and a few ideas about meal preparation. Well, what about during the meal itself? How can we engage elders and make that mealtime happier, a more positive experience? Well, we need to be aware of their sensory changes. We need to create a supportive environment so they can be independent, and we need to use the right approach. And we'll talk about these three things now. Have you ever noticed that sometimes people with dementia may stop eating or have difficulty during meals? There's a lot of different causes for that. They may have dentures that don't fit correctly and they're causing pain, or dentures that are missing. Medication can cause decreased appetite. They may not be getting enough exercise and so they're not really hungry. Sometimes people have something called visual agnosia, and you don't recognize items as the items that they are. The brain is misinterpreting the visual signals that it's receiving. Sometimes people overconsume soda or other sugary foods that diminish the appetite, or are given supplements too close to meals. So there's a lot of reasons that people may stop eating, and very often these reasons are linked to something that is caused by a sensory deficit. So if we are aware of these sensory deficits, we can make changes to the physical environment that will support the sensory changes and make people more independent. So let's begin with sensory changes in vision as a result of just normal aging. Our pupil size decreases, and this limits the amount of light that's received by the retina, resulting in the need for increased light for an older person. The typical 60-year-old only receives about a third of the retinal illuminance of a 20-year-old. Pupils also adjust more slowly when coming inside after being outside in very bright light. So this means we need to make sure that all of our interior spaces are evenly lit, and that we give people time to adjust before we ask them to do something. There's also a loss of elasticity in the lens that makes it more difficult to change focus between distant and near objects, and that's what causes us to need reading glasses. And that often happens when people reach about age 40 or 45. The change in the lens also scatters entering light and decreases the light intensity that a person can experience without experiencing glare. So management of glare is important during meals. This scattering of light reduces contrast and vividness too, so reds begin to look like pinks, for example. The older eye also loses some sensitivity to short wavelengths or blue light during the progressive yellowing of the lens. Okay? And then low vision problems include conditions such as cataracts, diabetic retinopathy, glaucoma, and macular degeneration.
Sensory jars are so much fun to make and so much fun to use. Here the elder explores jars of varying sounds or smells. The purposes include facilitating expressive language skills, maintaining manual dexterity and fine motor skills, as well as practicing sustained focus and attention. This activity is rich in sensory stimulation and provides the opportunity to refine the senses. The materials needed are a tray and contrasting placemat and identical glass jars. If you're making sound jars, you'll want to put items in each jar that have very contrasting sounds. For example, you might put sand in one, lima beans in another, and jingle bells in another. If you're making smelling jars, you'll choose different scents to put in each jar, such as lemon peel in one, sprigs of mint in another, and cinnamon sticks in yet another. For modifications, you can reduce or increase the number of jars, and I find that these activities spark conversation when done in a small group, especially the items that are smelled. These evoke memories of gardens and cooking projects and tend to lend themselves to reminiscing and conversation.